Mabe, and I am the Outreach, Education, and Training Manager with CoOportunity Health. And I really want to thank Lynn and KHI and Nicole for all the help they've provided me in being able to host this webinar. And I appreciate KHI hosting this webinar with CoOportunity Health and working with us on this. So just wanted to give a big shout out and say thanks so much. And I want to make sure that everybody understands if we don't get to questions today, that I would like you to go ahead and type in those questions, or you can just send those through Nicole, and I will collect those later on, and I will go ahead and email back answers, and that way you'll have that in writing. And just in case someone is not able to attend the webinar today, they will then be able to also receive questions and answers and be able to see what came out of the webinar. So with that, what I'd like to do is just quickly walk through everybody should have an affidavit of personal responsibility, and at the very top it says send to Kathy Mabe, and then I've provided my email address. Right below that, the attendees need to sign it, and then down below, that needs to be completed by the course monitor, the name of the student and so forth, all the way down needs to be completed. I have put my provider number in there already, and then down at the very bottom, again, the monitor must date it and sign that. So then we move to the sign-in sheet. So with the sign-in sheet, that needs to be completed, and the witness monitor must sign that also. So for each form, the attendee and the monitor/witness must sign. So there's two. So wanted to make sure, and please try to get those into me within 2 days so that I can make sure and guarantee the CE credit, because we have a lot to do with that as far as getting that turned into the Iowa Insurance Division, Insurance Department. So again, wanted to go through that, and if you have any questions later on about it, please make sure you have my email address. You can send me some questions. So with that, we'll go ahead and get started. As I said, welcome. This is the first of 3 webinars that CoOportunity Health will provide for you on the Affordable Care Act. The first one will be kind of a high-level overview, and over the next 2 weeks, we will kind of dive a little deeper into the details regarding individuals and then regarding groups, and that will be the next 2 Mondays. And I would like to make sure and remind everybody again, as I said, to email everything to me, and also if you have any questions or problems, make sure and get back to me later. So with that, we'll go ahead and move through the PowerPoint here. I want to make sure topics for today's discussions, individuals and families, small businesses. Again, just going to give you an overview on those. So I want to talk about the problems. So what are the problems? When you take a look at this slide, I want you to think about which of the problems shown probably isn't going to go away. Now, I know what you're thinking. You're thinking rising costs of health insurance premiums, right? And you could be right in the short run, but hopefully over the long haul, ACA will have an impact. We've got to be optimistic. Most of us are in sales. We want to make sure and be optimistic for the future, so I wanted to kind of introduce it like that. So as we move forward, are Americans ready? So when you read this slide from the broker point of view, are you finding this to be true with your customers and prospects? I think we are all finding that with something as complex as healthcare reform, most people need to hear this multiple times to get the details to sink in. You know, I know you will take away from this slide that there are a lot of people out there in your communities that need your help in understanding this and wading through the details to ensure they make the best decision for themselves, their families, and if they own a business, for their employees. So now the new insurance marketplace, and I may go back and forth. I'm trying to get used to changing from the exchange to the marketplace. So some of the slides still may show exchange, but we're really trying to refer to it now as the new marketplace. So isn't everyone you run across asking, what really affects me? Is there anything that affects me? I already have insurance. Maybe they tell you they have insurance, so they don't even need to think about this. You're probably finding that you need to be asking some really probing questions to make sure you really understand what their true situation is. So there's 3 big changes. I want to talk about it first. No pre-existing condition exclusions. I want you to think about family members, friends, and employees who have not been able to take early retirement because they had a serious health condition and could not get other coverage. I want you to think about the farmer who really needs his spouse at home to help with the farming operation, but can't because the spouse has to have a full-time job to enable them to have insurance since the family member has a health issue. I also want you to think about the entrepreneur who could be developing something really beneficial for your community, but they can't because they have to work for someone else for the health insurance. Can you see the opportunities here? As an employer, employers need to think about employees who really don't want to be there. They don't want to be at work. They're not as productive as they need them to be, and now they will have other opportunities. And you know, the people don't want to be there because maybe they have a serious health condition. It's not that they're you know, incapable of working. It's just they maybe are very ill and shouldn't even be working but have no other options. Another thing, you know, lifetime limits. I know in the past I've worked with groups with premature twins. It costs $2 million. So the annual lifetime limits, that's a big deal too. So as we take a look at the next item, no gender discrimination. Right now, women are rated higher. No longer the case after January 1st. Just mentioned the lifetime limits. Again, think about the claim issues you've had in the past, the claim problems, the premiums and claims that you look at as a broker. You can see that some people approach some of their lifetime maximums, and it can be pretty frightening for them and for the group and for the employer. Next, we want to look at the individual market, some of the changes that are coming in 2014. What's really key is October 1. Are you, your clients, and your prospects ready? People need to understand what the tax credits and subsidies really will mean to them. Think about a family of 4. At $94,200, they're at 400% of the federal poverty level. You know, tax penalties. I continue to hear people say they don't care about the tax penalty because it's such a small amount. People seem to just be hearing $95 instead of, for 2014, it is $95 per uninsured adult, or 1% of household income not to exceed $285. They seem to be ignoring the fact that this will go up each year. And I'm really concerned about the fact that they will not have the opportunity to purchase coverage until the next open enrollment period versus just the penalty they will have to pay. And also on this slide, it shows rates can be higher for tobacco use. Not sure exactly how this will be monitored, but a person is considered a tobacco user if they use a tobacco product 4 times per week. So again, something to think about with your clients. Okay, so health insurance marketplace. Key dates here. Always important to keep reminding people about these dates. The public needs to continue to be educated about the importance of starting early and working with trusted advisors like yourself so they don't run out of time and that they have plenty of help and information to make the best decision for themselves and their families. The government will start having public announcements about the upcoming open enrollment, but I still have concerns about that because a lot of people probably will slip through the cracks because they'll tune out these messages. You know, we all know what happens when we're watching TV or listening to something on the radio. We kind of flip around and change stations or leave the room and multitask, do something else when something that, that we think really doesn't apply to us comes on the screen. So I still don't think they're going to reach everyone that they need to. And all we have to do is go back to one of the first slides that said 42% of consumers remain unaware and confused about ACA. So again, keep these dates in mind. Then we'll look at the product standardization on the marketplace. Another big change is that health insurance plans will be certified to be sold through government marketplaces, exchanges, which we are now switching over, as I said, to call the marketplace, for January 1st effective dates. These plans will be required to offer essential health benefits, which I'll go over in upcoming slides. These plans can be offered in one of 4 tiers and a catastrophic option for individuals up to age 30 or who are exempt from the mandate. And these are only going to be available to individuals, not to small groups as far as the catastrophic. So making these plans become standardized will really help individuals understand the differences between the different metal levels and help them and you compare them and between the various insurance companies, because down the road you'll be able to take a look at these against other insurance companies on the marketplace. So when we speak about the actuarial value, it means that the plan covers approximately 60% of the benefits cost for the plans on up to the 90% with platinum plans. So one of the items here, guarantee issue, cannot be turned down for coverage. So one of the most important parts of the ACA is the provision that prevents insurance companies from rejecting people because they have a pre-existing health condition. Under this provision, all Americans are guaranteed coverage regardless of their health status. So while this is a wonderful new consumer benefit, it also strongly encourages people to refuse to pay premiums and stay uninsured, confident that they can get coverage whenever they want it. But that's not the truth, is it? In fact, when I was just teaching at DMAC this spring and told students that I was going to work for CoOportunity Health and gave them a brief overview of the ACA, a lot of them said, oh, they were not going to sign up for coverage during the open enrollment because they could get coverage anytime and not be denied coverage. That's all they got out of the messages that they've seen. I'm not going to be denied coverage. I can get coverage whenever I want. There's going to be this great open enrollment. Well, of course, I had to correct them regarding their interpretation of what was going to happen. And I did tell them to watch for the upcoming information in the news. And I explained to them that the only way for the government to overcome this obstacle was to make sure that no one could take advantage of the government's guarantee and then just sit on the sidelines until they actually needed the care. And then they were forced to make financial contributions before the fact. So premiums need to be paid in for the claims to be able to be paid in the long run, which of course is what the individual mandate is all about. Interesting to note, Massachusetts was the first to put an individual mandate in place, and it worked like a charm for them, increasing the number of insureds in the state to 97%. So it worked for them. We'll see what happens in the future for us. Okay, so tax credits and subsidies. This is going to be very key and important to people. So when enrollment through the health insurance marketplace starts in October, people may be eligible for new kinds of tax credits and subsidies that they can actually use right away to lower what they pay for monthly health premiums. And the tax credits can lower that right away. With most tax credits, you have to wait until you file your taxes to get the credit. But with the new tax credits available through the marketplace, it lets them reduce their costs right away. So people who qualify can take the tax credit in the form of advance payments to lower their monthly health insurance premiums starting in 2014, which can help make insurance more affordable for them. And you'll see then they'll actually see the tax credit and see that what they're eligible for immediately. Once they go through the first step of the process as far as filling out the application to see what they qualify for, then they go on later on and apply for coverage. So they'll see the amount of tax credit they're eligible for after they submit their marketplace application, and then they can enroll in a qualified plan. So they'll be able to see how much the tax credit will help them with the different types of plans that they have that they're eligible to. And the eligibility is going to depend on income and family size. And the amount of tax credit, they need to make sure and be aware that, let's say that I enroll in November to be effective January 1st. And they're taking a look at my, my financial information and telling me what I qualify for. I need to remember down the road that if I actually have, let's say I have a raise and my income changes, if I'm concerned at all that it might affect my tax credits that I'm being allowed at that point, I would want to talk to a trusted advisor to make sure and see if I need to do something else, because I wouldn't want someone to end up having to pay any money at the end of the year when they really could address the situation up front, and maybe their tax credit is lowered a little bit. I'm not sure exactly how that's going to work, but I'm kind of trying to research that at this point. Okay, so as we move forward, we see the number of people that are uninsured, unemployed, self-employed. So how does this relate and translate to Iowa? Well, approximately 254,000 people will be eligible for tax credits, a huge number. 114,000 have insurance and could compare coverage in the marketplace and possibly even change coverage. 93% are working families, and about 94,000 work for a small employer. And just because they work for a small employer doesn't mean they have coverage. Okay, so now, and I see the numbers we have on here. I continue to hear anything from 19 million, 25 million. I see sometimes 30 million as far as the nationwide the numbers uninsured. So that number kind of seems to change a little bit, but no matter what, it's huge, and you can see that. Okay, I'm not going to get into this slide. I just kind of wanted to show that to you. I'm going to update next week regarding what's going on in the state of Iowa regarding Governor Branstad, but I just wanted to leave this in here so you could see the various states as far as what's gone on so far. Okay, so let's talk about the actual tax penalties. Okay, regarding the tax penalties, regarding the actual mandate to buy, minimal essential coverage is defined as coverage under certain government-sponsored plans, employer-sponsored plans, plans in the individual market, grandfathered plans, and any other health benefits coverage, such as a state health benefits risk pool as recognized by the Health and Human Services Secretary. So when we look at the slide, we say $95 per insured adult or 1% of household income, but cannot exceed $285. For 2015, $975, and 2016, $2,085. So you can see that it definitely, so people are just hearing the penalty, it definitely does go up, and they need to also be thinking about the fact that if they would become, say after March 31st, they don't sign up for the coverage and they develop cancer or some other serious illness, they are not eligible next January. They need to take a look at the next open enrollment period, which will be the next October, to be covered January. To escape the individual mandate penalty by remaining a dependent covered by, and this provision of the ACA took effect September of 2010. Also, young adults under 30 have another option. They will be able to buy a catastrophic health plan through their state's marketplace at a price typically below that of the least expensive plan available for adults age 30 and older. So do you think the new health care system might be weakened if the young and healthy invincibles have alternatives to buying full health insurance coverage? Well, there's a possibility there. So it'll be interesting to see how all of this shakes out as far as who's not covered and what the options are. So again, just keep in mind that catastrophic plan that's available to certain categories. Okay, we just hit on tobacco usage just a little bit earlier as far as under the insurance reforms. You know, as I mentioned earlier, hard to monitor. But since smoking does contribute to a lot of major health problems, it will probably be something that is looked at again later on regarding how to make sure and accomplish this. You know, I can't guarantee that, and I can't say what's going to happen regarding insurance companies and how they're going to address that. You know, are they going to just have a question on the application and people can say, you know, no, I don't smoke, because maybe they, you know, are quitting as of, you know, that point. I don't know what they're going to do, but we'll let you know as we know more about this as far as how it relates to insurance companies. Okay, so who's impacted by the changes? Well, as you can see, basically everyone is impacted by ACA. So the challenge to everyone participating in this webinar is to find ways to help your clients and prospects make the best decisions, because it's not just a health insurance decision. This is a financial decision, because it's going to cost them, because of the individual mandate, they have to have the insurance. If they don't take the insurance, there's going to be financial penalties. It's a financial decision because a lot of people will qualify for subsidies and tax credits, but unless they're moved in the right direction to go through the marketplace and check into this, they will not be able to make the right and best financial decisions for themselves. So again, that's where you come into play, helping people make the right financial and healthcare decision by knowing where to go and who to turn to. So, I don't have insurance. Let's take a look at it. So how do you help? How you help is to help them to shop. Encourage people to shop and compare. They won't know unless they take a look and get more comfortable with everything, get comfortable with the marketplace. And I like to think about the marketplace like Expedia and, you know, the different ways that we take a look at airline tickets. You know, it's just a matter of plugging in, you know, different information and then taking a look at different scenarios and how they're all compared side by side. So that's what it'll appear like to the consumer, and that's definitely somewhere where you can fit in on that part of the process to help encourage and engage the consumers on you know, the best decision for them. So you have to help them get comfortable. I listened to a webinar conducted by Enroll America this past Friday about what's the message. And they talked about 5 clusters of targets. They talked about the uninsured, unnecessary, and uninterested. Number 2, they talked about reluctant but reachable. The 3rd category, desperate and believing. The 4th category, connected low-income women. And the 5th, insured but at risk. And I'm going to talk about these 5 categories a little more next week when I can kind of dig through more of the information, and about the 4 key messages to reach the most uninsured people. For example, there was one of these categories they talked about that it's not about talking to this group, and it really was younger males. It was about you need to reach them through their mothers, because they did a study. They reached out to the public and tried to find out, who would you listen to? What are you going to do to get this information? And most of them said they were turning to their mothers, so they're turning to their families. So it talked about how we reach the different people that are uninsured to help them make the best decisions. So we help them by shopping. They need to go shopping because they may qualify for different types of cost-sharing subsidies. They need to go to the marketplace October 1. So how do the changes impact private insurance today? Well, once again, even if they have insurance, their interests are best served if they're able to compare what they have today with the new marketplace. And again, as a broker, if you are working side by side with your customer, you're able to help guide them to obtaining and getting the right information. You definitely don't want your customer to come back to you later on and be mad because their neighbor told them about a great new benefit or lower rates they got from shopping on the marketplace. And especially now, what the neighbor can do is encourage them to use the person that they used to get that information. So it definitely does help you to be able to be up on the marketplace and know what's going on and be able to guide them through this process. And I do know that it's going to take a lot more time. However, it's a good way to help cement that relationship as far as getting them into the right plans. Again, I recommend that over and over again, to get them to go shopping, to take a look at what's available out there, see what they might qualify for through the marketplace. Okay, so if they have insurance through the employer, once again, hopefully it's one of your customers, and if not, it's a prospect, and that's where you can, maybe their current broker has told them to, just renew and stay right where they are. Well, it might be time for them to take a look around. So if you're able to talk to them and at least show them some options through the marketplace, whoever is playing on the marketplace, that can definitely help them. And again, I talked earlier about the people that are not able to leave a group plan. Think about that trapped early retiree. They'd like to retire, do something different with their lives, take a different job, do something they really love, but they can't because they've had a health condition. They're 63 years old. They don't want to wait for a couple of years until Medicare can kick in. So you're able to help them. So there's a lot of different people and help. Again, shopping. That's the key. That's the answer. Shopping on the exchange, if nothing else, just to gather the information. So what about things that people can do now? As I mentioned before, this will have a huge financial impact on people. So they need to start early, and they need to compare. Once they start comparing, if they haven't set a budget, you can help them manage that and understand the need to do that. And you can help provide them with good websites to look for information on their own versus trying to pick through everything. Think about that. You may want to start collecting websites you think are very valuable and worth looking at, because if they start Googling things on their own, they're going to end up finding some websites with old information, incorrect information, and and maybe just some controversial opinions versus good information that can help them make the right decision for them and their family. So, I think one of the most important things is helping them set a budget for that. They need to understand what their budget should be for the health insurance. They may look at a plan and think that they need the one with a certain level of benefits and co-pays and so forth, where if you actually are able to walk through it and talk to them about what their real needs are, they may be able to take a different type of plan. But they won't know that unless they have a great advisor to work with. So again, these are some things that you can talk to your customers and prospects about now. So as I mentioned, today is going to be just kind of a deep dive, and we're not going to go into a lot of great detail with the groups and so forth. But there's huge market changes for groups, small groups, large groups. Since we're going to go through this in a few weeks, I just kind of wanted to go through a few slides and I'll let you see them ahead of time as we prepare for the upcoming webinars. So what concerns you most about it, and what about employers? Giving them the most. What will it cost? So these are good questions for you and the people you serve. How do you develop more to personalize them for your customers? This is very personal, so you need to be very personal with your customers and prospects. So we take a look at what will it cost. They will not understand that unless they're able to understand all the different plan options and can compare everything with you side by side. How much time will it take to manage? Well, that's why you need to encourage them now to start setting appointments. And if it's a group plan, they need to start modeling and looking to you for those tools to help them determine what they need to do. When will my employees, again, if it's a group plan, when will my employees see a benefit? Well, that's something that you can answer for them also, and it depends on how they set up their plan and what they decide to do with it in the future. So again, where can they get the information they can trust? From you, from the websites that you provide them with, and who can help make sure that they're prepared. And again, it all points back to you the broker. You need to help make sure that they're prepared for all of this and that they start early. Maybe they start early in October, even though they don't want to have coverage until February or March. But again, they do need to start early looking at this so they'll have some information. Okay, so as we take a look at the group market and what's happening, again, I'm just going to quickly kind of read through this just so you have some things in mind for the upcoming webinars. We know there's required coverage categories and different levels and amounts, expanded benefits. So again, we'll talk about that. Rating and market rule changes, small groups, new rules, new changes there. Shop the exchange, and again, I'm working on changing these slides over to just say shop the marketplace. So the shop exchange for small group, expanded tax credits, talk about that because we're breaking it down by different size, requirements for groups with more than 50 employees, the employer mandate, and definitely new taxes and fees to support the marketplace. So when we take a look at the next slide and talk about some of the different things that are required, the essential health benefits I mentioned, we'll talk about that a little bit more, and that's on some of the next slides. Out-of-pocket maximum, some of the new accumulation rules and ceilings, small group deductible ceiling, and then the metal plans, just to make it more consistent and able for the employers and the employees and individuals to understand. So here's the slide that I mentioned earlier regarding the essential health benefits. I didn't show this earlier, so we'll just kind of take a look at it now. Again, the categories, no lifetime limits, no annual dollar limits, which again, very key when you've ever worked with groups that have had children with serious illnesses and almost maxed out their plan, or even adults. And technology is great, but it does cost, and so the costs are going up more and more to save lives. Emergency services, hospitalization, maternity and newborn, mental health and substance use disorder. So again, there's the list of the 10 categories of care that must be included in all small group plans. And here we see the slide on the small group plans and related to the metal plans. And you can see, again, it's the same metal plans and the same actuarial values assigned to them, the 60, 70, 80, and 90%. And you can see how this, if it's consistent across the marketplace like this, it'll be a lot easier for people to understand. Because I know myself, working for a broker for 18 years, there were plans that were all over the board. So it was very hard, and especially I worked with a lot of union groups, to be able to really compare things so that they didn't have a grievance or something later on. So you had to be very careful to make sure you were comparing apples to apples. And now it will make it easier for you to be able to do that. And then what happens next? It has to do with the type of service and the customer service. So if all things are pretty equal, then they're going to look to you and for the great service that you can provide to them. So there's rating and market rule changes coming up. So big changes for small groups, and then there's changes for all groups across the board. So as we look at this slide and note there are big changes, I want you to keep in mind that we're thinking about small groups between 1 to 25 full-time employees and then 26 to 50. So a new change that applies to these groups is the fact that now the age bands will be 3 to 1 versus 5 to 1. So it will be a little more compressed. And this might lead to higher rates for younger people and rates for 55 to 64-year-olds that could remain a little more stable. Although I did hear the other day that they're really taking a look at that. I can't say that there's any changes that's going to be made to that regarding what happens to that as far as compressing that or not and the younger people. But we'll let you know as we learn more about that also. So again, when you consider the changes to all groups, I want you to think again about the removal of the pre-existing conditions, guaranteed issue, renewal coverage, and what that really means to the population. As I mentioned earlier, you need to think about the family members, friends, and employees who have not been able to take early retirement, farmers, any other types of self-employed people who need their spouse involved in their employment situation, but they can't because they have to take the insurance because of a health problem. So again, you can see the opportunities here, I think, opportunities for those people to have coverage and have different choices in their lives, and opportunities for you as far as being able to help these people. The next slide, the employer requirements and the shop and tax credits. Next week we'll walk through the rest of this slide, but today I just kind of want to walk through, and I don't like to really read slides. However, I think this one's a really good one to really just focus in on the different table there, the left side of the table, where very, very clear insurance requirement, not required to provide health insurance, 1 to 25. So they do not have to offer the health insurance, and they are exempt from penalties, so they don't have to worry about the penalties. But there's also tax credits involved for this size group. So if they have fewer than 25 full-time employees, they pay average annual wages below $50,000, contribute 50% or more toward the employee premiums. They can possibly get up to 50% for profit firms as far as tax credits, up to 35% for nonprofits. So I think that's really key that they understand that this is a size group. If they're offering the health insurance, they need to go through the marketplace to be able to actually get those tax credits. So they need to shop the exchange, and the shop is the shopping portal for small businesses. Metal plans offered by private insurance companies, and again, we don't know exactly who's going to be on the marketplace in Iowa. We do know CoOportunity Health will be there, but as far as other companies, I'm sure there'll be many more, but we just don't know at this point. And outside the exchange may continue to purchase coverage off the marketplace exchange. So this size group, they can shop off the marketplace also. But if they want those tax credits, they need to shop through the actual marketplace for that. So again, I just wanted to kind of show you that table so you have that in mind for next week. And again, the shop is the Small Business Health Options Program. Okay, and then just so you have just kind of a quick glance at this before the next couple of weeks when we talk about it a little bit more. The employer penalty is 51 plus. And again, on the left-hand side there, we show the groups that do not provide coverage, what their triggers and their fees are, and then on the right, the ones that do provide coverage. But the coverage, if it's unaffordable or does not provide what's called the minimum value. So the trigger, at least one employee obtains subsidized coverage, and the key there is subsidized coverage from the marketplace. And the fee must pay a fee equal to $2,000 per year for each full-time, that's 30 plus hours, minus the first 30 employees. So they are able to subtract off the first 30 before the fee kicks in there. And then to the right, talking about if they do actually provide the coverage and they have 51 or more full-time employees, and if they have at least one employee receiving subsidized coverage from the marketplace, then what's going to happen is they'll have a fee equal to the lesser of $3,000 for each employee receiving the subsidized coverage, or $2,000 for each full-time. So you can see that there are some different fees and some different triggers involved here that employers definitely need to be aware of, and that's something you can work with them on, model their plans to see where they are as far as size and where they are as far as providing coverage. Do they is it affordable? Do they meet the minimum value, which we'll go into again in another couple of weeks? So there's a lot of different things you can look at for them. And then I do think it's important, the people that you work with, they may not care about the different fees, but they're here, some of them are here to stay, so you should be up on those and be able to talk to people about them if they ask you a question. So you have the PCORI fee to begin with here, which is individual market, small group, 51 plus, and it's assist patients, clinicians, purchasers, and policymakers in making informed health decisions. There's the insurer fee. It's going to help fund the health insurance marketplace, and it's an annual fee on the health insurance sector allocated by market share to fund health insurance marketplace subsidies. Then you have the excise tax here. You have the traditional reinsurance fee, and that reinsurance fee helps stabilize the individual and small group market, and the fee funds reinsurance for high-dollar claimants in the non-grandfathered QHPs, qualified health plans. The excise tax imposes taxes on insurers and employers who offer rich benefit coverage, and that's effective 1/1 of 18. And then the last category is kind of levels the playing field by protecting health insurance issuers of risk-adjusted plans such as CoOportunity Health against adverse selection by kind of redistributing premiums from plans with healthier populations to plans with unhealthier. So, and this is going to be a permanent fee. So again, those are fees that you can look up and get a little more detail on, but I at least wanted to kind of address it a little bit today, and we'll talk about them more in the future too. So as we move forward to, what are some of the components driving pricing impacts? And that's something that your groups and individuals, people will ask you about. So, thinking about the individual market, the compliance, it's driving significant price increases. And again, you can go back to those different, the chart regarding the different fees, the new taxes and fees. So there's a lot of things that are going into this. So average increase, you need to be breaking that down, showing that some companies will break out the different fees and adjustments so that you'll be able to show that to the employer groups. Individuals, they may not really be aware and understand that, and again, you can help them understand what's going into the different pricings. Small group market, large group market, again, we'll talk about that more in the future. But this is kind of a simple way of breaking it down. The rating rule changes, benefit enhancements, because those benefit enhancements definitely do add to the pricing, and again, new taxes and fees that are coming into play. So as we look at, again, some of the key dates and changes for group plans, because some of you may be talking to some of your groups in the next week or two before we meet again. Here's some of the dates. I won't read those to you, but there will be a sample model letter that employers will need to send out to all employees explaining the new marketplace. So some of the key things to keep in mind now is communicate. Keep in mind that this is a time to make sure that their employees, the employers you work with, and their employees really understand what all of this means, since those groups do not want their employees who are covered under the plan, if they have 51 plus employees, to run to the marketplace. This is a time for the broker to reach out and help in these areas. Other things that you can do to help them is help them understand that now it's time to brace for some of the rising costs. We just talked about some of the new fees, so now is the time to help them model their plans and understand what they can do to mitigate some of these increases in fees and so forth. And also think about changes such as, if they have an employee who has never enrolled in the plan before, and now maybe they're going to enroll because they were covered under their spouse's plan, and maybe the spouse's plan no longer allows them to be enrolled. So, they need to consider that. They can't just look at their existing group and say, okay, this is what I've got. They need to be aware of what's going on within their community, because, they may be in a small town and they understand something's happening with another company in town there. At least the benefit of being in a smaller community, they can maybe know a little bit more about what's going on and be able to react more quickly, where a larger community, they may not know everything that's going on within different companies. So again, that's for you to be asking questions, finding out, be aware of what's going on so that you can help them, again, make good decisions. They need to be checking out their insurance options. I've said it numerous times throughout this presentation. Now is the time for them to shop. I mean, you want to help them shop versus someone else, your competition, helping them shop in the marketplace. So some of the things you can talk to, and again we'll talk about these in greater detail in the next few weeks, that you can talk to employers about doing now. They need to know the law, and that's going to come from you, helping them understand that. They need to view health care reform as an opportunity, and if they understand their employee group and what's going on there with the employees and the families, they can stay ahead of that, stay ahead of the curve there. Model the company situation. So again, this is something you can work with your agencies and with KHI as far as the different modeling tools that you have available. Determine if they'll continue to offer coverage. Some of them may all of a sudden start saying they're going to back out and not offer coverage. Well, if they have all their ducks in a row, if you've provided them with all of the information, they may make a different decision versus just jumping and reacting to some of the things they're hearing from some of their friends or neighbors. They need to get organized, and they can get organized with your help. If you have all the proper things in place and the tools for them, you can help them be organized and feel confident in their decision making. You need to help bring the employer mandates to them and explain the premium changes and help them develop a strategy, because a lot of them won't have a clue about how to develop that strategy, but you're able to share with them some of what other companies are doing, so you'll be able to be a great resource. And again, you need to reinforce that they need to use trusted advisors. I mean, we definitely are as a company, relating to our the people we're talking with, that they need to always be reaching out to trusted advisors. And again, as I mentioned, I'll share more information next week regarding that Enroll America webinar that I listened to last week. They basically were saying that people are saying they want people to sit down with them and walk through all of this. They want somebody to hold their hand as they go through the process, and so that's a perfect time for you to get involved in that. So again, I'm going to go through more of this next week, but again, market environment, I wanted to kind of just show you that and talk a little bit about the birth of co-ops. With the co-ops, and that's what CoOportunity Health is, only basically one page of the Affordable Care Act enabled us to be able to be in business. And we are an alternative. We're the government option. We're nonprofit, consumer-led, member-governed. So, profit is not in our mindset. Our mindset is to help our members, make the best decisions, the right decisions for themselves. Our board of directors will be elected by members, and eventually in a couple of years must include a majority of actual members from CoOportunity Health. So the members do not just enroll in health insurance. They join. They become a part of us. So you can see that we have initial funding through low-interest loans that have to be paid back for startup 5 years, and the solvency 15 years from the point of draw. And there have actually been about 24 that have been approved with CoOportunity Health. We have multi-state, so we have Nebraska and Iowa that we work in. And again, we obviously would have to be on the marketplace because we're through the Affordable Care Act, but we're not restricted to it. So you'll be able to look for us off of the marketplace also. So you can see some of the CMS funding to date here, highlighting Iowa and Nebraska there. So we have a lot of people we can turn to. There's weekly phone calls that we get information from CMS regarding what's going on with the co-ops and with the Affordable Care Act. And I want you to think about it, Iowa and Nebraska. Think about how we operate. We are truly, in the Midwest here, we're very proud people. And I want to tell you about an audit that we just had to go through. We went through the first audit. They came to Iowa and audited Iowa, and we passed with flying colors, and they said that we really set the bar high for all the other co-ops. So, we're really excited about what we have going on here at CoOportunity Health as far as the people that we've employed, and some of you, know the owners of our co-op, and I shouldn't say the owners, but the founders of the co-op. Cliff Gold with Wellmark for many, many years, a lot of great experience there. We have David Lyons, our CEO, the former insurance commissioner, and I can tell you that already that, what David Lyons has been able to do is take a look at some of the things that have come down from the Affordable Care Act and take it back to some of these meetings to Washington, D.C. and say, look, have you really thought this through? Look at this, this, and this, and they've been able to help change things. I mean, the application originally was 20-some pages long, and it's down to like 5 and 7 pages in some instances. So they've been able to talk through some of the problems and be able to get people to listen, to actually listen and make some positive changes. So as I mentioned again, we'll go through some of these later on in the next 2 webinars. So we originally were approved in February of 2012. Midwest Members Health was the name, and we changed that to CoOportunity Health. We work with health partners. They're paying our claims, and Midland's Choice. So most of you know about Midland's Choice, a great network, PPO network here in Iowa. I have over 95% of the Iowa physicians and hospitals, so great network to work with. I know that I personally worked with them for many years with school districts in Iowa. And so here, I'll show you some of the differences here. How will co-ops in general compete with commercial carriers, and just showing you, we're definitely a nonprofit organization. You can see all profits have to be repaid, government loans, and go back to the members or provide better benefits to the members. So risk pools, they have aging risk pools. We're member-driven. I'll let you kind of look down there. Products. Innovative designs. We're going to be looking at wellness, member-owned and operated. So again, with that, I'm going to kind of tie up this and want to make sure and remind everybody to look for us on the internet, and just make sure you know that you can, something you might want to share with your clients. If you look at the Consumer Guide and Employer Guide for New Health Insurance Marketplace, we have a new website that will be up probably right around the 17th of June, so encourage you to take a look at that. A lot of good information in this guide for your customers and prospects. So with that, as I mentioned earlier, what we're going to do is, I don't really see that I have any questions here at this point. What I'd like you to think about is, if you think of questions later on, you can always email those through Nicole, or you can go ahead and email those to me directly, since you have my email address. So we'll look here and see if I can catch a possible question. Okay, somebody asked about the directions at the beginning regarding the technical issues. Okay, so, and I guess when you say technical, I guess I think you mean regarding what you need to do with the affidavit. So I'm going to just address that quickly, because I think that's very important, because I have been getting quite a few of these back that I've had to return to people. If you take a look at the affidavit, if you have that close at hand, my name and email address is at the top. Right below that, you do need to, as the attendee needs to sign that and date. Right below that, it says affidavit of course completion, to be completed and signed by the course monitor or witness. And so the name of the student, course, address, date where the course was taken. I've put in the provider number there. You need to fill in the rest of that information, and the monitor needs to sign it and date it, that very bottom line. So there we have the attendee and the monitor have signed on this form. And then we also have, as you've always had in the past, when you've attended different CE courses, you have to sign in, and there's the agent last name, first name, the NPN number, the license state, email address, signature, and the witness. So on each form, there's a place for the attendee and a place for the witness monitor to sign. So you need to do that, and those need to be returned to Kathy Mabe, and you have my email address at the top of the affidavit form. And you'll have a new one of these for each of the webinars. So again, I do need those sent to me, and then if I have a problem or a question, I will, whoever emailed me, I will go ahead and reach out to whoever's email address I have there. If I can read the email on the other forms, I'll take care of that and get back to the person directly. But I also wanted to make sure that you know that when you're signing that form, it should be a disinterested party. It should be, it can't be a family member, or it can't be a financial interest where, for example, if I'm in the room with my boss, I can't sign for my boss. However, I can sign for a coworker. Okay, so I shouldn't sign the form as a witness monitor for my boss, but I could sign as for a coworker. Okay, so let's see if I have some other questions here. Okay, so at this point, okay, and I've had somebody ask, if we don't need the CE credit, do we still need to complete the form? And you do not have to complete those if you do not want the CE credit, if you don't need it or want the credit. No, I do not need anything turned back into me. And I will, within hopefully the next few weeks, I will email out the certificate to those of you that actually do apply for continuing ed. Okay, so I'm trying to scroll through here and see if I can see some of the other questions. So I've got through a couple of those. Okay. Okay, so, and like I said, if there are other questions that I missed that I'm just not able to access here, they will show up on a report for Nicole, and she will print that off and get those questions to me so that I can go ahead and answer those. So if you did send in a question, I'm not able to see that, we'll get that, or you can also email Nicole or email me. So with that, I do appreciate your time and look forward to being able to present a webinar next week on individuals, and I will go ahead and get updated forms out because it'll have to have a new course number. Well, actually, it doesn't have a course number. The sign-in sheet will have a different course number and date on that, so I will get that back out to Nicole so that can be sent out. But you can use the same blank affidavit form, just print off another one. So with that, we'll go ahead and end the webinar, and I thank you very much for your time. Thank you.